Hello, everyone, and my name is Ellen. I am the Programs Coordinator at Arthritis Consumer Experts. Welcome back to the 8th Annual CR Arthritis event at the Canadian Rheumatology Association and Arthritis Health Professional Association's annual scientific meeting. Today, I will be interviewing Dr. Shahin Jamal, rheumatologist and clinical epidemiologist at Vancouver General Hospital. She's also a clinical associate professor at the University of British Columbia, and she is the co-PI of the CanRio, Canadian Research Group of Rheumatology in Immuno-Oncology. Welcome, Dr. Shahin Jamal.
Thank you.
We are excited to have you today, and we want to get to know you and a little bit about your expertise in the area of rheumatology. Can you share a little bit about your journey on how you got here?
Yeah, so I'm a rheumatologist. I practice in Vancouver. I did my undergraduate degree actually in physiotherapy at McGill, and I loved musculoskeletal health and wanted to be sort of dive deeper. So I went into medicine. And then when in medicine, I decided to do internal medicine. And while doing that, I really loved immunology and kind of combining musculoskeletal health and immunology, and rheumatology was just the right fit. So so that's how I ended up here. And then I moved back home to Vancouver to be closer to family. So
wonderful. Yes. We're grateful to have you in BC, and you also teach and do research. Is that correct?
Yes, I like doing a little bit of everything. So I really like having junior learners in my clinics and, going through, I try to challenge them and, teach them how to think critically. And I also enjoy research because it keeps me grounded and it allows me to answer questions that I see in the clinic. So research I like to do in a team. I don't, spend most of my time in research. I spend most of my time in clinical care and maybe one day a week doing research. So that's good.
Best of multiple worlds.
That's it. Yeah. Yeah.
Great.
And I have great colleagues across Canada to do it with. So that's, I think, my biggest enjoyment is the fact that I get to work with awesome people across Canada.
That's great.
So, and people having learners in the clinic, they challenge you, they ask really difficult questions sometimes, and yeah, so it makes it fun.
That's so great to hear. And Dr. Jamal, can you share with us, why is it really important to both detect, diagnose rheumatoid conditions as early as possible?
I think particularly with our diseases, sometimes they can be challenging, and patients are often, going from one doctor to another or different specialists trying to find help. I think the reason it's important to diagnose early or to recognize early is because there are many options now for therapeutics. And if we can get people identified early, we can get them treated early and get them back to functioning normal and having, a good quality of life. Often when there's a delay, people can develop damage, whether it's in the joints or other organs, and that can have a long-term impact, negative impact long-term. Whereas if we can get people seen and treated early, they usually have a normal life without the damage and long-term implications of that. So yeah,
like you said, the benefits of that early intervention for all chronic conditions, really.
That's right. Yeah. I think education's another huge part of it, right? So as a patient, if you understand what's happening, then you're more likely to accept the treatment options that are provided for you. And then you're more likely to buy in to your own care. And that will hopefully lead to better long-term outcomes. So yeah.
Agreed. And as the general public may not be super familiar with rheumatic conditions, how do we increase public awareness so that, if someone is experiencing certain symptoms, they know where to go or they know who to see?
Well, I think talking is, first of all, people sharing stories. So things like this, where we get to share stories. I think there's still a public misconception that arthritis happens in old people. And I feel like often young people, when they have symptoms, they ignore them. They look for help and they get told it's growing pains or it's this or it's that. You're too young for arthritis. So I think there's a lot of this still misconception. And yes, osteoarthritis or degenerative arthritis typically is more common in older people. Many inflammatory connective tissue diseases happen at all ages. And so again, it's that public awareness and then healthcare professional awareness. And I think that comes from talking. And we're lucky now with social media, right? So there's good and bad with social media, but good with social media is there's lots of places that you can find like this, where you can find information through websites and reputable sources to help advocate for yourself when you have symptoms, know where to go and who to ask and what to ask.
Yeah, that's so true. And as somebody who went through the process of diagnosing or being diagnosed with rheumatic condition, I was so grateful that when I was speaking to my healthcare provider, my GP, and they listened, and they weren't like, it's just hair loss, right? They're like, let's go get it treated. And I'm like, thank you, because I didn't know who else to go to. And absolutely, having those conversations is really hard, but so important.
Right. And I think that's what many people, when they're younger, they blame it on something. Oh, like my hair's falling out because I have exams and I'm really stressed out at school, or, oh, I have this rash because I don't know, I must have started a new moisturizer, I mean, and sometimes, yes, that's why you have hair loss. And sometimes, yes, that's why you have a rash, but always sort of excusing things away might not be the best strategy all the time. Right. So.
Agreed. And you were speaking about, credible information sources. If someone is curious and they are experiencing unique symptoms, where should they go? Are there specific websites otherwise than speaking to their GP?
I mean, I think there are good websites. So for example, the Arthritis Society has lots of great resources available online. And then there's, Rheum Info is a great website. The Canadian Rheumatology Association has websites, and links to patient websites. There's the CAPA, I think it's Canadian Arthritis Patients Alliance.
You got it.
And then there's ACE, Arthritis Consumer Experts. So there are lots of these types of websites where I think the main thing is, looking at if there's references, looking at where they're getting their information from, if it's from healthcare professionals, if there's buy-in between the patient and the healthcare organization. I think the places where maybe it's a bit dangerous, or sometimes there's blog groups that maybe, there's a lot of opinion, it's opinion based and rather than credible source based. And that's where you have to be a bit careful. I don't think they're bad. I think it's great. And I think for many people, there's social networks that support them. And I think that's important for patients. But I think it's just also really important to make sure that you have your eyes open. And if something doesn't make sense or fit, then you look for corroboration from a different site, so yeah.
That's a great, great tips in terms of looking for references, right? Looking at who is being spoken about or cited in at the bottom of the page. So as a consumer, scroll down and see who they're linking.
Who wrote it? So first of all, look at who wrote it, right? And then normally anything that's reputable will have references or should have links. And so really figuring out where the information is coming from. So for example, if you look at Wikipedia, I know my kids in school, they're told they're not allowed to get any resources from Wikipedia because it's not cross-referenced. And, I actually sometimes find credible stuff on Wikipedia because I click on it when it tells you, and then I look at where the information comes from, right? So I don't think there's anything that's blanket good and blanket bad. I think you have to look at everything objectively. And kind of figure out yourself if it's coming from a credible place or not. So yeah,
super practical.
Practical. That's right. So.
And our next question, as you know, the theme of this year's meeting is diversity, equity, and inclusion within the healthcare system. From your opinion and from your experiences, how can, all levels, whether that's patients, healthcare providers, and the healthcare system, incorporate some of these values into their lives?
I think that is the $1 million question.
Yes.
Because there's many, many layers to this, right? And we are all, formed by the quote unquote intersections that make us who we are, right? So that comes from our own ethnic backgrounds, our cultural backgrounds, our religious backgrounds, our birth order, our education, our socioeconomic, all of it, everything that sort of makes us who we are, and we're formed by it. And I think that maybe the first step is for all of us to dig deep and understand ourselves and why we react to certain things and don't react to certain things and why certain things push our buttons. That said, I think if you think about it from, what we talked about a little bit earlier, for example, in autoimmune connective tissue disease, arthritis, there's this misconception still that it happens in people who are older. So I think, breaking through those barriers and saying these, conditions can happen in anyone of any ethnic background, of any gender, of any age, and really looking at each individual objectively based on what they bring to the table, rather than they don't fit into this box, therefore we're going to ignore it, And I think that comes from the individual's perspective, from the healthcare provider's perspective, and also the healthcare system's perspective. And it's difficult societally to be able to do that quickly, but I think that's where we need to end up going. I don't know if that makes sense.
Absolutely. I think,
So I think we also have to be kinder to ourselves. And I think we have to realize ourselves what our own biases or expectations of ourselves are. I know, for example, recently I've been having a lot of discussions with my female medical colleagues, right? And how we, up until now, me being a female physician and a mom, I've always tried to not downsize, but I've worked despite being a mom. Like, I haven't tried to let that impact my ability to work and what I do. And it's always like, I need to accomplish this and not let being a mom get in the way. Whereas for men, traditionally, and maybe not today, but traditionally, if a man does something in terms of childcare, it's looked upon as, wow, what a good dad. And whereas when a mom does the same thing for childcare, it's like, oh, she can't do her job because she's doing childcare, And so I think it's breaking through those boundaries, even on a professional level, and starting with ourselves. I shouldn't feel guilty that I ended clinic early today because I wanted to be volunteering on a field trip. Whereas that's how I feel, and I shouldn't. So I think it's that. I think it's all of those things that societally, traditional things that now we have to just kind of break through. It starts with ourselves, because we all have biases about stuff, right? Depending on our lived experience. So that's my opinion anyways. I don't know if you disagree.
No, that was just so powerful. And I think you really hit the nail on the head. Like, the first step is to look and examine our own biases, like you said, in our own gut reactions. Like, are they correct? And to feel that self-compassion before, like, how do we express compassion to those around us if we can't take a deep breath in, take a deep breath out, and be like, you know what, I'm doing an okay job.
That's it, right? And I shouldn't feel bad. If I want to take my lunch break and go to a workout class, that's okay, because that's the only time in my day that I have to exercise. I'm going to do that. And if that means that I see 1 or 2 less patients, or I don't check my email over lunch, or I don't reply immediately to this text, that's okay, And I think it's just learning, but it's difficult when you're just figuring out who you are we all have these roles we play, right? We play the role of a person with our own health considerations. We play the role of whatever employment that we have if we're employed. We play the role of somebody's daughter or son, somebody's potentially somebody's spouse, somebody's sibling, somebody's friend, somebody's parent, and how do all these roles fit in together, right? And if your parent is sick and you want to take them to an appointment, then you should. And if you can't, then you shouldn't feel guilty. And I think it's all these things that all of us live. And our health comes into that, right? So if you have symptoms of something, but you don't have time to figure out what those symptoms are, or, let's just say, I don't know, you have mechanical back pain and you've been told that you should go to the pool twice or 3 times a week because it might help your mechanical back pain, but you have 2 kids and a spouse and a job and you can't figure that out. Then I think you have to figure out, how can you adjust things so that you put yourself a little bit higher? Because all of us deserve that, So it's interesting because I have 2 preteen daughters, and I tell my kids every day, I say, because now they're in that, in that world where their peer is really important, and what they wear is important, and how their hair looks is important. And, like my daughter came home yesterday, Mom, I think I need some black masks, black disposable masks. I was like, why? Well, because they're nicer than the, I was like, what? There's mask fashions in high school. But I say to my daughter, I say, it doesn't matter what you wear. You have to love yourself first before you can expect other people to love you. But then we have to do that ourselves, right? So, and even as patients, we have to do that. As individuals with our own health, we have to do that. So it is difficult. So anyways, that's a whole, but I feel like that's where the diversity, equity, inclusion, because we're all different and we all come from different playing fields. And so how do we equalize that? I don't know. And I'm just talking about maybe a little bit of gender and socioeconomic, but there's so many levels, right? So many levels of it. So anyways, I think it's really good that we're having these conversations though now, and that we can talk about it. And that's what I appreciate about this CRA meeting, is that we're putting it at the forefront. How we all have biases and we treat people differently depending on our biases, and we expect different things from different people depending on our biases, right? So we accept and we expect. So, if you have, somebody is rude to you, but they look a certain way or behave a certain way, you might accept it from that person, but somebody else who looks a different way, you might not accept that same behavior from them. I don't know if that makes sense. But I think it's really understanding ourselves and why we behave how we behave.
That's true. I didn't even think about the expectation part of the receiving end. So that's thank you for sharing that with me. And I feel like, what a great conversation.
Well, I feel like I send a patient to, I don't know, if I send a patient to an orthopedic surgeon, for example, and they see an old guy, and the guy's in there for 2 minutes and doesn't really talk to them and is brisk, the patient accepts it. And they're still grateful because they're like, at least they saw me. Because in their mind, seeing a surgeon, it usually is a 2-year wait. If they had to wait a year or 6 months, they're really happy and satisfied with that. Whereas I feel like if I behave like that with them, they wouldn't accept it, because their expectation of the interaction with me is different than their expectation of the interaction with that other, whether it's, whatever it might be. And so again, I think it's that whole, it's acceptance and expectation, and some days we all have bad days, and some days, I might be running behind. I might be worried about something happening with my kid or something happening with my parent. And I might not be able to give that same amount of myself to my patient that day, but their expectation is different. And so sometimes there can be, and so I think all of us need to check in with ourselves and see what, why we behave with people, how we behave with people, if that makes any sense. I don't know if that makes sense, but
absolutely. I think that is, you answered the last question on any tips. I think, let's check in with ourselves. Let's kind of analyze our own behaviors. Let's dig within to see where maybe we aren't so objective all the time. So thank you, Dr. Jamal. That was, so insightful.
Thank you.
And with that, amazing. Thank you for your time. I want to thank the audience for joining us. And I encourage you to stay tuned for more exciting interviews from the CR Arthritis event 2022. We're going to say goodbye to everyone. Thank you. Goodbye. All right.